ILSA was really started by the FNIH because we were building a program in liquid biopsy, and we're hearing from the field that there were other activities going on that we should be coordinating with. Some of them were partners. Actually, one of the partners that we're referred to regularly has a president who sits on our board, right? So we knew there was a lot of activity going on there, but we weren't necessarily sure what the level of coordination that had going on was. So we basically just brought them all into a room one year at AACR and said, let's talk about what's happening in the liquid biopsy space and how we want to coordinate. And through that conversation, we realized that there was quite a bit of activity happening. And it all dovetailed really nicely together, from the pre-analytical work that was taking place through the reference materials that I mentioned in my talk, through to kind of utility and ring studies that were happening in Europe, and that they all kind of informed each other. And there wasn't a whole lot of overlap, but there was quite a bit of synergy through those efforts. And we wanted to make sure that we continued to have that dialogue, so that way we kind of could connect the dots as we moved along collectively. And that's really how ILSA was born, was just a dialogue that we wanted to keep moving forward. And at this point, it's largely just a community of collaborative groups who are working towards the use of liquid biopsy and want to be able to communicate together about how to do that effectively.